Men can be diagnosed with breast cancer. We just don't hear about it so often. But we're going to learn more regarding this subject from our guest. He is Harvey Singer of Laguna Niguel, California, a survivor of breast cancer. In addition to being a survivor, he spearheads an organization that exists to support men diagnosed with breast cancer. And we're going to learn more about that too. So here he is, Harvey Singer. And Harvey, welcome to Cancer Interviews.
Thank you, Bruce. Happy to be here to help.
And we're looking forward to hearing your story on all of its various fronts. Now, before we get to the interview, it is our custom. We'd like to hear more about our guests, learn more about them, their life outside of cancer. So if you would, Harvey, tell us a bit about where you're from, what you do for work, and what you do for fun when time allows for fun.
Okay. I'm a 69-year-old guy born in 1954. I was raised in Philadelphia, Pennsylvania through the Philadelphia public school system and a product of Temple University. I'm a graduate of Temple University with a BS in journalism. I started my career in the publishing business and it wavered over to my wife's family business, which is in the uniform side of the world for medical and restaurant professionals. In 2000 and, well, let me go back a little bit. In 1983, I had my first of two boys. They're now older adults, both engaged to be married next summer. And for work now, I work for a company called ChefWorks. We're the largest provider of uniforms to the restaurant and hospitality industry in the world. That's my story outside. I love to play golf. I love to exercise. I love to take care of my health, more so since cancer. But I'm very cognizant of my health and my exercise regimen and eating properly.
So if you went to Temple, that makes you an owl, meaning that we're going to be getting a lot of wise words in this interview. So to get to your cancer journey, Harvey, all of we cancer survivors at one time or another were going along just fine as far as our health was concerned. And then we noticed something was not quite right. When did you initially notice something abnormal, and how did that abnormality manifest itself?
So I grew up in Philadelphia, and I have a lot of friends from Temple University. We're spread all across the country. We're very dedicated sports fans. And once a year, we would get together for a long weekend, play some golf, become frivolous like our old college days, and eat well and have fun. And I was at one of these annual reunions in Chicago, actually, when the Philadelphia Eagles were playing the Chicago Bears back in 2008. And a friend of mine that I hadn't seen in a year came up and he gave me this big bear hug, and he's a big guy. And when he hugged me, I got a pain that shot like a knife from my left nipple into my ear. And I almost brought me to my knees. It was so painful. And I said, okay, something's up. And I started poking around my left nipple. And by the time the end of the day happened, I realized that there was something abnormal. My nipple was inverted, which I had noticed before, but I thought it was just because I was a little bit out of shape. And there was a lump underneath it. So when I got home after that weekend, I said something to my wife, and she goes, "Oh, you're always looking for something. You're such a hypochondriac. Go to your doctor and let him check it." It turned out to be a her, by the way. Let her check it. And I did. 2 days later, I made an appointment. I got in, and she took about 5 seconds running her hands across my left breast area. And she said, "I'm going to send you for a mammogram." I said, "A mammogram? How can a guy get a mammogram?" She goes, "Guys can get mammograms just like women with small breasts can get mammogram, but I think we need to do it. It's a Friday afternoon. I want to make sure that, you don't spend the weekend worrying about this." So I went across to the radiology office. I got the mammogram. Half an hour later, they came in with an ultrasound machine, realized it was there was more there than just a little lump. They set me up for a biopsy the following Monday or Tuesday after the weekend. At that point, I already knew that I was probably going to be diagnosed with breast cancer. My sister at that point was a 3-time survivor. My mom's a survivor. There's a genetic history there. And my sister had kind of warned me that I could be potential for this, even though I'd never been genetically tested. But I knew in my heart it was there. And I went for the biopsy, the needle biopsy, which is not a fun experience, by the way, but we all have to do things that aren't fun. And 2 days later, my phone rang and there was a call, and the doctor on the other end said to me, "Mr. Singer?" I said, "Yes." She goes, "Sir, you have breast cancer." And that was the start of my journey. Everything goes 600 miles an hour after that. But I had some experience to rely on because my sister had been through so much. And she kind of pointed me in the right direction. I called a couple of doctors that I was very close with, and they got me in to see a breast surgeon immediately. And I went through a full mastectomy of my left breast. Everything was clean. It was stage 1. The margins were clean. But after pathology, they realized that it was more invasive than they thought just by the state of the tumor, and was recommended to go through 12 weeks of chemotherapy, prophylactic chemotherapy, just to make sure that we didn't miss anything, those cells escaped. And I went through all that and moved on my way. 15 months later, I was diagnosed with prostate cancer. So caused by the same genetic malfunction, genetic mutation, the BRCA2 mutation. So I've been through 2 cancer journeys, but the breast one was more impactful because most guys, if you live long enough, are going to get prostate cancer, but most guys don't get breast cancer. And the fact that I was diagnosed with something that guys hardly ever get, I realized right away the system wasn't set up for guys. It was not established where they even had forms that were legitimate for men. When you go in for checkups, they would ask you if you have vaginal dryness, when your last period was. At that point is when we decided, my sister and I decided to change the way things are done for men. We have 5 boys between us. We know the boys are potential carriers. So we started the His Breast Cancer Foundation to make it a little easier, guys, give them a little better roadmap and a place to go for some guidance and for some courage, quite honestly, and then a lot of information.
Harvey, quite obviously, it's a horrific day for anyone when they are diagnosed with cancer. In your case, and under no circumstances am I making light of your diagnosis, but it sounds like to some degree you were prepared for this awful news. In any form or fashion, did that soften the blow?
No, and I wasn't prepared, actually. I mean, my history is if you put something in front of me, I'm going to confront it. I'm not going to run from it. I realized very early on that A, the system wasn't set up for me, so I was going to have to do things differently. And B, the only way I could take this on is to challenge myself against everything that was coming at me. I started researching all my doctors, but no, I don't think anybody's set up for that diagnosis. I mean, it's always a hit over the head. Especially something that's so rare in guys. I mean, it's, there's 1 in every 1,100 breast cancer diagnoses are actually male. In my case, it's about a 6.5% chance because I carry a genetic predisposition, but it's still not something the odds are still in your favor. 6.5% is not a lot. That means, it's 93.5% that you're not going to get it, right? So you think the odds are in your favor, but no, I wasn't prepared for it, but I decided to attack it rather than sit back. I think one of the biggest problems with people, and something that we preach to our group, our advocacy group, is that you're in charge. You now get to make the decisions. I actually had a call with an oncologist this morning for something else, and we were just discussing some other study that I'm part of on pancreatic side. And you have to become your own advocate. You have to understand the information and challenge you. Doctors are great. They're geniuses in most cases. They make great decisions, but in most cases, they're taking care of 300, 400 patients at a time. And if they make a mistake and you die, they go to the next patient. As a patient, you get 1 shot. So I think being educated and finding the information, which is out there today, as much as information as you want on any type of cancer is out there, you can find the answers to some of the questions and challenge your doctor. It's just, I took it on head, but it didn't soften the blow. That was your question initially. It didn't soften the blow.
By the way, you're confident. We are confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon so you'll be notified the next time we have a new interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. One thing we have learned, Harvey, from doing interviews with a number of people who have been diagnosed with all different types of cancer is that with some types of cancer, there are some very unfortunate stigmas attached thereto. People diagnosed with lung cancer often have to answer a question, how many cartons of cigarettes do you smoke a day? Those diagnosed with liver cancer are suspected of partying too hard, and that's why they got liver cancer. And both those stigmas are quite a bit off the mark. Now, any diagnosis of cancer has stressors, but what was it like, not from an internal perspective, but from an external perspective, what you might have heard from others? What was it like being a guy diagnosed with a cancer that many associate with women?
It was interesting. A lot of my friends, well, first of all, it was very emasculating. It's not something you're supposed to get. You're supposed to be a guy. You're not supposed to get this. I had friends that they tried to be funny. They say, "Oh, when you play golf, you want to play from the ladies' tees, from the red tees, because do you need a different bra?" You get and they did it in jest, and I handled it, but people around me didn't like it too much. My family didn't like it. They thought it was obnoxious, quite honestly. You're put into a world that's not set up for guys. You go into a women's breast center, and most of them are called women's breast health centers, and they put you in a pink gown, and they actually show you around like you don't belong, and they're afraid you might see some other woman's breast while you're in there. So they kind of hide you in rooms until it's your turn and make sure the coast is clear. It's just, the whole system was set up so faulty. And when I questioned it, from the outside, they'd say, well, like when I would go in for my appointments, the first thing that the receptionist would say is, "Oh, are you here for your wife?" I mean, even the offices themselves don't understand the process. I can't tell you going on 15 years that I've been dealing with this, how many medical professionals I've run into. For other things, you go into the hospital, you're having whatever, a colonoscopy or whatever, and the nurse is taking your history, and she's like, "Oh, I didn't even realize guys could get breast cancer." It's so swept under the rug that half the I met doctors that didn't know this. It's like, how could you not know this? How can a professional oncologist not know that a guy can get breast cancer? I won't mention names, obviously, but I have met them. And it's just, from an external side, it's emasculating in one way. You realize the ignorance of the system sometimes in the other side of it. But I've always learned to talk about it. And that's part of my deal is I'm going to talk about it. I'm going to walk down the beach with my, mastectomy scar and hope that somebody looks at me and engages me so I can explain to them why I got it, and that you could get it too, and that your husband could get it too if it's a female, and try and educate people. And that's what we've spent the last going on close to 15 years doing, trying to educate the guys that you can get this and you can die from it. And it's actually more likely that if you get it, you will die from it 4.5 times more likely than a woman getting it, because it's going to be discovered later. Your stage is going to be later. You're not screened the way women are screened. You're not encouraged. It's all this, we call it pink washing of October, where it's Breast Cancer Awareness Month, and they don't even talk about guys. The NFL did it for years. They had this whole breast cancer thing, and we wrote to them every year and said, "You have a male audience. Why don't you just mention the fact that guys can get this?" I get it. There's only 2,600 of us a year that are diagnosed in the U.S. But if you're one of the 2,600 or one of the 2,600's family, it's important. It's the outside world doesn't understand it. We're trying to change that. We have changed some of the things. We're going to continue to work until my last breath. I'm going to continue to push this message to guys and to help them maybe save their life or get through it. Just make them aware that it can happen. Be ready to understand that it can happen to you.
Harvey, you briefly touched on something that I would like you to elaborate on a bit. All types of cancer are a bit different. They each have their own idiosyncrasies, but one theme remains common for any type of cancer. And for different types of cancer, it is more difficult to achieve. But it's so important to catch this early. Early detection is paramount. How does a man go about getting screened for breast cancer?
It's actually very simple. If you go to my website, hisbreastcancer.org, we teach you how to screen yourself, to do the same digital screening that basically a woman is taught to do. But basically you lift your arm, you run your other hand underneath it, you go around in a circular mesh, and you look for anything that's inconsistent. The thing that it's actually a lot easier for guys to catch this, because male breast tissue is very minimal compared to a female breast tissue. So there's a lot less places that can become invasive. And it's almost always within, a couple millimeters of the nipple on either side. So you can screen yourself. You can make it playtime with your partner and let them screen your chest area for you. If there's any family history at all, and something I preach dedicatedly, on your father's side, on your mother's side, it doesn't matter. Genetics reacts where it can be passed down from either side to either gender. If there's any family history of prostate, breast cancer on either side of the family, pancreatic, melanoma, you can ask to be tested and screened. And if you get tested and you think you're holding a predisposition, a genetic mutation, then you can go get a mammogram. I have nephews that are doing that on a regular basis. They're still in their 30s. They're getting annual mammograms. You can get a mammogram. You can get an MRI. But you to get the insurance to cover that, you kind of have to have some reason for it. And that's why we encourage genetic screening. But you can check yourself. Guys are funny. Guys don't like to go to a doctor. It's just part of our innate nature. They'll blame everything on something else. If you have a pain in your chest like I had, they go, "Oh, I pulled a muscle. I was wrestling. I was, I swung too hard on the third hole." They'll always try and blame something else for the circumstance. But you just have to be aware of your body. Understand your body, and any change you should note. And if you do, a little digital feel around that area, or an indentation of your nipple, which is a huge flag. If one nipple starts to indent, that's a sign that something's wrong. There's obviously, if you get to the point where it's bleeding or leaking fluid, now you've become further staged. But initially, yeah, you can screen. You just have to know how to screen. And if you go to my website, we'll teach you how to do it real quick. It's a 5-minute thing.
Harvey, I want to get to your organization and its website. We're going to do that, but I have one other question as I circle back a little bit. Let's go back to your journey with breast cancer. There must have been a juncture in which you felt you were getting the upper hand on cancer. Could you recall what that was like? Because any man watching who's just been diagnosed with breast cancer or has learned that they may be a candidate for this will want to hear this story. So if you would talk about kind of the tail end of your fight with breast cancer.
So I'm not 100% sure how you want me to go about this, but as a cancer patient, I never feel, there's two things I don't like. When people say I'm cured and I never have to worry about it again. Once you're diagnosed as a patient, unfortunately, you're a patient for the rest of your life. I don't care how many years out. I don't care if, 5 years out, you're good. You don't have anything to worry about. I don't buy into that. I've seen too many circumstances where it's come back 12 years later. I said, my sister's been diagnosed 4 times with breast cancer. Between her third and fourth, she had 12 years. So I don't buy any of that timeline. I just think you have to be an avid screener. So I never think you're in the clear, so to speak, although I hear people say that all the time. I know we'd like to feel that way. And I know people I've met that say, you know what? I've been through it. I had it. I did chemo. I'm good. I'm never worrying about it again. If you can do that, more power to you. Most people can't. I can't. My journey, I went through surgery. I went through mastectomy. I went through, I didn't have any radiation for my chest, but I did go through chemotherapy for 12 weeks. I still screen twice a year. I only have one breast removed. If I knew today what I didn't know back then, I probably would have had both breasts removed, a double mastectomy, and most women do that. But guys, it was not. Everything moved so fast. I only had my left side removed. I still screen both sides, but I screen twice a year, 6 months MRI, 6 months mammogram. To me, it's just part of the challenge. There is something that's real nature called scanxiety. Any cancer patient knows that. It's, when you're due for a test or a blood marker or another scan, you have the anxiety of, okay, they're going to find something here again. We all go through it, but that's better than finding it later and not knowing what was going on. So my journey never stopped. It eased up. Like I said, 18 months later, I had prostate cancer, so I had something else to worry about to deflect that worry. But I just think it's something you have to live with the rest of your life, and if you're smart, you'll stay on top of it.
Okay, and perhaps we should define terms and say the operative word should be that we've survived cancer and never that we've beaten it.
Correct. I think
because there is, of course, a difference. Now, Harvey, let's talk about the present and the future with your organization, how it came to be and what it does.
So after my breast cancer diagnosis and going through contemplating all the things that you go through when you go through chemotherapy and you have a lot of time on your hands to think and wonder, two things happened. One, I said the system has to change. I have 2 boys. My sister has 3 boys. We have no girls. Each one of those kids was 50-50 to carry the same mutation that we carry. We didn't know at the time who was carrying what. But we had to do something to change the system. When I started looking at the male breast cancer, there was nothing out there. The internet was live and active, but when you Googled male breast cancer, all you found was somebody was paying tribute to a lost relative, a father or brother that had passed away from it. There was nothing informational. My sister and I in 2010 said, we're going to change this. We started a fully nonprofit 501(c) company, and we named it His Breast Cancer Awareness Foundation, Inc. It was there to be a source for information, a source to go for contemplation, to find out anything we could teach them about the journey they were about to take. And we got it up. Fortunately, my sister's son, my nephew, was an e-marketing genius, and he helped us get everything up and rolling for us on our website. And it was amazing. It was like an instantaneous hit. People started contacting us from all over the world that were diagnosed, that were looking for a source of information, just somebody to help them plan a journey for them. We can't say anything medically. We're not medical providers, so we have to be careful that we do have medical providers, oncologists, genetic counselors on our board that we can relate you to. Refer you to, and they can answer questions for you on the medical side, but we can help lay out a roadmap. We were the first in the world that we know of, and there's been a few others since, and it's great. We welcome everybody that can help guys learn about this, that there's a place to go, whether we don't compete with each other that I know of. I try not to anyway. We work with genetic organizations. We work with cancer organization, with breast cancer organization. It was interesting because like Susan G. Komen, who's the largest breast cancer foundation in the world, never mentioned guys. I mean, they had their pink walk every October, and they raised a ton of money. They're by far the largest money raisers. Unfortunately, there's become such a huge organization that everything goes back to the research part of it. It goes back to running Susan G. Komen. But we worked with them for years until they finally got a male site, a male portion of their site up to us, dedicated to the male side of breast cancer. We've done that with a lot of different breast cancer organizations. Look, just include a little blue in your pink. You know, it's not a totally pink world, which is why my logo is half pink and half blue. We did that for a reason. Informationally, by the way, the his refers to a guy, but it also happens to be my exact initials. So the name was pretty easy to come by. My middle name's Irwin with an I, and his refers to a guy. And so that the naming of the foundation was interesting, but it was easy for us. But it's been an interesting journey, and one that I say I still work full time, but I say I have 2 jobs, one that rewards me and one that pays me. My real job pays me. My foundation work rewards me. Every time I get a note back from a patient that's gone through it and said, "Oh my God, you guys have helped me so much. You've helped my family so much. It's just worth everything that we put into it." And we're going to continue to do it. Like I said, until my last breath, I will continue to preach this from the mountaintops that guys can get this, and guys are going to die from it if they're not catching it early enough.
Harvey, and if somebody wants to contact your website, what's the address they go to?
It's www.hisbreastcancer.org. Just all one word, his, H-I-S, breastcancer.org. The foundation is His Breast Cancer Awareness Foundation. On our site, you can learn a lot of things, and we have a lot of information there. And we have a Facebook group of male breast cancer survivors that we're open to everybody. We have to let you in to make sure that you're not going to, do anything detrimental to us. But it's growing very rapidly. We only started that about a year ago. I wrote a book available through Amazon Publishing called "Sir, You Have Breast Cancer," which was the first words I heard when I got my diagnosis. It's an interesting book. It's more of a story of my life and my journey, and with a little bit of humility, a lot of humor about some of the funny things that I went through. I try not to write it too technical and too depressing, so I try to interject some funny information to it. But just a story. I wrote most of it while I was going through chemo, so it gave me something that was cathartic to me to do something. It's my first book. I toyed with writing a second one, probably after I retire. I will. Maybe a little bit more information guided. We've done movies. We've funded, our foundation to help fund documentaries. One called Pink and Blue: Colors of Hereditary Cancer, which I think is great for everybody to see. It's actually a great journey. My sister and I played a part in it. There's some very good information. Susan G. Komen's in the documentary, and some very, very renowned breast surgeons are in the journey as well. But yeah, www.hisbreastcancer.org, and we welcome anybody that wants to learn from us. You can tap us on there. We answer every email that comes in. We will respond to you.
Excellent. Harvey, I think we're going to wrap up now, but before we wrap up, there's always a question that we ask of our guests, the same way that we have the same first question for everybody. We have the same last question as well. Imagine that you have encountered somebody who's just been diagnosed with breast cancer. There might be a million things you'd want to say to this man, but if there was one thing that stood out above all other things you would want to impart, one thing you would want to make sure this man walks away from by way of information and or inspiration, what would it be?
First, I tell him you're not alone. We're here. We have a group of people that can help you. Two, and to me, it's still the most important thing. This is now your most important job you'll ever have in your life. Get educated. Research everything you can find on everything, every piece of information on your cancer specifically. I mean, cancer has so many permutations. Breast cancer alone has over 10,000 permutations. There's no cookie cutter answer to everything. So the more information you have, the better off your decision-making will be. And it's your decision. It's not your doctor's decision. It's your decision ultimately to your care, your treatment. It's just one of the most important things I'll tell anybody. You're in charge, not your doctor. Educate yourself. And if you don't like your doctor, you can fire your doctor just like you can fire your plumber or your mechanic. Find a different doctor, but you're in charge. That's my biggest piece of advice.
Excellent. Harvey, a wealth of information on a subject that we had yet to address prior to this interview, and we're addressing it now, and our audience is so much better for it. So Harvey, thanks very much for being with us on Cancer Interviews.
Thank you. I'm happy to spread the word and let guys know that this is important, and just check yourself, and you can stem this at the beginning if it happens to happen to you, and it can happen to you. Appreciate it, Bruce.
Yes, Harvey, and one more time, the web address for His Breast Cancer.
It's www.hisbreastcancer.org. His Breast Cancer Awareness Foundation. If you put in His Breast Cancer in any Google search box, will probably pop up first.
Excellent. Harvey, again, thanks so much.
You're welcome, Bruce. Good luck to your audience.
Thank you. And that's going to wrap up this episode of the Cancer Interviews podcast. We want to remind you, as we always do when we wrap up, that if you are on a cancer journey, just like Harvey said, you are not alone. There are plenty of people out there like Harvey who can be of help, and organizations like His Breast Cancer that can also come to the rescue as well. So until next time, we'll see you on down the road.